Diabetes social media extraordinaire Charisse asked me to tell you guys a little bit about why I will wear blue every Friday in November. The answer is simple. I wear blue because diabetes is invisible. Sure, I may wear an insulin pump and a CGM, and a discerning eye may be able to tell that my bracelet is actually a medical ID. But I can hide all of those things, and no one would know the difference. I wasn't diagnosed with type 1 diabetes until 1 week before my 22nd birthday. Before that, my only exposure to diabetes was watching Steel Magnolias with my mom, and the type 2 diabetes that caused my grandma's stroke. There had to have been other people with diabetes around, in my church, at my school, in my neighborhood, but I never saw it. By simply wearing a blue shirt, attaching a blue circle pin to my jacket or purse, or adding an extra blue bracelet to my wrist, I can help bring awareness to diabetes both in the United States and around the world. There was a time a few years after my diagnosis that I found myself without health insurance. I was living in Southern California and found myself traveling a few short hours down to Mexico to purchase my life-saving medication at a cost I could afford. In my middle-class upbringing, it was not something I ever imagined doing. For the past 2 years, I've traveled to Haiti in the spring. On those trips, I've looked for people living with diabetes. On the first trip, I saw a table with a glucometer and a few bottles of test strips in the hallway of a clinic where patients were recovering from injuries sustained in the earthquake. I asked the nurses on my second trip if they knew of anyone living with type 1 diabetes. They didn't know of a single patient. Similarly, Frio has tried to donate their insulation packs to third world countries such as Haiti. They're unable to donate as many as they'd like. Why? Because people simply aren't living long enough to use them. This is unacceptable. The flight to Haiti is less than 2 hours. A distance of 2 hours can determine whether or not someone lives or dies with diabetes. That is not a statistic I can live with. I wear blue because we need to bring awareness to diabetes. We need better care and support for those living with diabetes. Something as simple as wearing blue can bring awareness, and awareness leads to education. Education leads to advocacy. Advocacy leads to action. And with action, we can change the lives of people living with diabetes in the United States and around the world. So please join me in wearing blue every Friday in November. And don't forget about World Diabetes Day on November 14th. Please remember, wear blue. Be like Bess, wear blue every Friday in November. You're gonna wear blue? Are you gonna wear blue? See, she's got blue.